Hi, everybody. My name is Dr. Cooperman, Todd Cooperman. I'm a physiatrist. I'm a rehab physician. And I was asked to speak tonight on rehabilitation of the brain tumor patient. So I welcome you all tonight, and I hope that I can help share some information with you that will be useful. The talk I'm going to give is a talk about rehabilitation as it pertains to patients with cancer and also with brain tumors. There is a great deal of overlap, and we're going to go over some of the scientific evidence-based medical literature, which talks about why even bother to even talk about rehabilitation for this topic. And it's a growing field that you're going to hopefully learn a great deal about. The Monmouth Medical Center is lucky to have a really excellent brain tumor center with excellent staff, and it's affiliated with a rehabilitation hospital as well. I'm affiliated with both. I'm the section chief of physical medicine and rehabilitation here at Monmouth, and I'm also the medical director of Health South Rehabilitation Hospital of Tinton Falls. So in my experience, I've treated many patients with various cancers, various brain tumors. So this is a topic that I've actually begun to be somewhat more keenly interested in over the last couple of years, and it just so happens the medical literature is just growing exponentially. And we'll keep this informal because this is a small group, so if anybody has any questions, feel free just to ask. If you want to ask during the talk, that's fine. If you want to save your questions to the end, that's fine. And can you all hear me okay? Okay, good. Yeah, small group. So this is a book which recently came out not too long ago by the Institute of Medicine in 2005. And the Institute of Medicine is the health arm of the National Academies of Science. And what this study came out by saying was that they realized that patients who are diagnosed with various cancers, brain tumors included, are often left in a state of limbo, which I'll get to a little bit later, in the transition from being a patient who is diagnosed with a various type of cancer or tumor to a survivor. They call this being lost in transition. So this report detailed how upon finishing treatment, many patients moved from a regimen of care to a place in their recovery that offered few guidelines on how to approach the next phase of their life. That was ironically in spite of the fact that many of these patients faced residual deficits, which really affected their ability to care for themselves and integrate back into the community. And these patients often needed both physical and emotional support to become the person that they wanted to be. So in January of 2012, the Commission on Cancer by the American College of Surgery came out with a whole new set of standards for cancer programs, which you may have heard about. If not, you will be hearing a great deal about it. The whole idea is to give patients what's called a survivorship plan, to basically teach them how to go on and how to live their life as a survivor. This plan has to, by definition, include a summary of their treatment, the expected long-term and short-term effects of cancer therapy, and strategies to help prevent any potential complications. So it's very comprehensive. Hospitals have 3 years from January 2012 to institute these guidelines to help people transition from cancer patient to cancer survivor. If they don't meet those guidelines by January 2015, then they risk losing accreditation by the American College of Surgeons as a cancer program. So this is how seriously the American College of Surgery and associated societies are taking the idea of rehabilitation in cancer and rehabilitation in brain tumor patients. The American Cancer Society actually came out with a goal that by 2015 they want 90% of all patients diagnosed with various cancers and brain tumors to be offered appropriate rehabilitation therapies if indicated. So the first recommendation for this plan is to recognize and accept the fact that survivorship is a distinct phase of cancer care. Once you reach that point that you're a survivor, that's a distinct phase that needs to be recognized and treated. The second one is that each one of these survivors needs to be given a detailed plan. And this is just a snapshot of the American College of Surgeons, their cancer program. As you can see, rehabilitation is included in their treatments along with medical oncology, radiation oncology, surgical procedures. They accredit more than 1,400 programs and hospitals throughout the United States. And they also require that for their cancer committees that they invite a rehabilitation specialist to serve on their cancer committee, each institution. So rehabilitation is really being recognized and taking a front seat. There's a growing body of evidence-based medicine. That's a big buzzword in medicine nowadays. That means that there is medical proof, statistically significant literature, which shows that certain facts are relevant. There's been a growing body of evidence-based medicine to talk about the efficacy of cancer rehabilitation and for brain tumor patients. These are in prestigious journals, the National Institutes of Health, the Medical Journal of Australia, the Oncologist, Mayo Clinic, Journal of Clinical Oncology. So that's just but a few. Here's an NIH study which talks about, they wanted to see, is this something that is stagnant? Is it a field of medicine that's growing? Is it a field of medicine that's not very large? And what they concluded was that cancer rehabilitation is an expanding area with a growing scientific production. And with the rapidly aging population and the higher number of cancer survivors, there will be an increased need of resources for the aftercare treatment of these cancer patients. And that explains why this is such a growing field. Another interesting study which I took here was a study out of Australia that looked at, is psychological distress in people living with cancer, brain tumors, various cancers, related to the fact that they were diagnosed with cancer? Is it related to the current treatment, which can of course have side effects, or the actual level of disability? What's causing those patients the most psychological stress? And what they concluded, what they found out after a thorough study, was that the risk of psychological distress in individuals with cancer relates much more strongly to their level of disability, their inability to function, than it does to the cancer diagnosis itself. So understanding that in context of the survivorship plan is that as these patients are diagnosed, treated, get better, reach survivorship, they're often forgotten about, sometimes left in a state of limbo, as I mentioned. But that still is a problem because these patients have disabilities which are causing them significant stress, even though their cancers may be something that's not acutely an issue anymore. Another interesting study out of The Oncologist talked about the effectiveness of multidimensional cancer survivor rehabilitation and cost effectiveness. Right, that's a big word in medicine. Everybody hears about cost effectiveness. Everything has to be cost effective nowadays. And what they concluded was that studies published so far report statistically significant benefits from multidimensional interventions over usual care, most notably for the outcome of fatigue and physical functioning. And I'm going to get into that later. By multidimensional, they mean various disciplines working together as a team. So rehabilitation specialists of various fields, physicians, physical therapists, occupational therapists, speech therapists, neuropsychologists, social workers, nurses, and various other medical professionals all working together as a team is really becoming the gold standard for rehabilitation for cancer patients, brain tumor patients included. And what's very interesting too is that numerous studies have shown what a powerful effect exercise can have on cancer. What we're learning so much about nowadays is that there are many different factors which mediate cancer. Some of them being hormonal, some of them being other factors as well too. In both breast and colon cancer, regular exercise has been found to reduce the recurrence of the disease by up to 50%. Whenever I talk about this, I always say if they could come up with any chemotherapeutic agent that could reduce recurrence by up to 50%, it would be on the front page of all the papers. But exercise doesn't have that flash. Rehab isn't as fancy as some of the other treatments out there, but it's a huge factor. And what happens a lot of times is that cancer patients, no matter what the diagnosis is, they're reluctant to exercise. They're scared. They may not have exercised much in their life before. They're scared to exercise now that they have this new change, this new diagnosis. And importantly, they're afraid often to discuss it with their oncologists, and their oncologists and their treating doctors don't often discuss it with them. So the Mayo Clinic, in the Journal of Pain and Symptom Management, came out with a study that showed that few oncologists actually even bring up the issue of exercise and rehabilitation with their patients. And again, just like with breast cancer and colon cancer, it's been shown in the Journal of Clinical Oncology that for prostate cancer, for patients who benefited from that, they participated in a moderate resistance exercise program, and it improved their quality of life and decreased fatigue. And it's felt to regulate hormones that are related to prostate cancer risk. So the body of evidence just continues to grow. Another interesting study by Dr. Seville from the Mayo Clinic, she looked at the prevalence and treatment patterns of physical impairments in patients with metastatic breast cancer. And what she concluded was that more than 90% of patients had issues which could have benefited from rehabilitation, but fewer than 30% of patients actually received that rehabilitative care. So of course that's unfortunate and something that needs to be addressed. You may hear a great deal about cancer rehabilitation in the media too. It's making its way out of just the medical literature into the everyday media. There was a great article earlier this year in the Wall Street Journal prescribing a new kind of rehab for cancer survivors. There was a very good article just from September 2012 in the Connecticut Post, Life After Treatment. Cancer rehab programs provide services for survivors. So if you haven't heard about it, most likely you will. In a nutshell, one of my most powerful lessons I try to bring home to people when I speak to them, when I even speak with other medical professionals who may not always be thinking rehab, is that exercise can be a powerful tool to help cancer survivors physically recover their strength and stamina. And I always want to say that this is in no way meant to be a knock towards the surgeons, the medical hematologist oncologists, the radiation oncologists, the neuro-oncologists, because they are dealing with extremely difficult medical situations in which they are using very complicated therapies and treatments to help their patients. So sometimes rehabilitation and exercise is not on the forefront of what they're thinking about, and what they do in a great fashion. So I give them full kudos. I just want the world, including physicians, patients, and everybody in between, to be aware that exercise is really important. The American College of Sports Medicine, you may have heard, this is also just in the general literature, has very specific guidelines as to what type of exercise should be performed by patients under 65, over 65, based on whether it's aerobic exercise, strengthening exercises, very, very specific guidelines as to how many minutes per week, how many repetitions of each exercise you're supposed to do. That's for the general population. But they recently held a roundtable on what to do about exercise for patients with cancer, for cancer survivors. And one of their biggest recommendations they concluded was that they need to avoid inactivity. Cancer patients need to avoid inactivity. They need to return to normal activities as quickly as possible after surgery. They need to continue normal daily activities and exercise as much as possible during, if possible, and after non-surgical treatments. Both strengthening and aerobic exercises have found its place in the cancer rehabilitation world. Of course, there are always exceptions. Each patient has to be taken individually. Certain precautions may need to be taken, but on the whole, the same exercise guidelines that apply to those without cancer apply to those with cancer as well. We all know that this doesn't just affect the cancer population. The vast majority of Americans, with or without cancer, don't exercise enough or as much as they should. So it's something that we all can learn from and benefit from. We also all know that treatments for cancer, such as chemo, radiation therapy, surgery, they can be physically draining. But even here, exercise and rehabilitation can be very, very helpful. It's been shown that exercise in cancer patients has been shown to improve bone mass, which otherwise may be lost. We know that weight-bearing exercises improve bone mass, reduce osteoporosis, reduce osteopenia, and exercise can help cancer patients because very often that may be a side effect of some of the treatments as well. We also know that it's been shown that moderate exercise boosts the immune system, so that's very helpful for patients that may be undergoing treatments which can impair their immunity. We don't want to go to high intensity exercise. We want to go with moderate. We don't believe in no pain, no gain. So right there, that's something I just wish to share. It's moderate. If you take something to too far a level, then the benefits start to be outweighed by the negative effects. It's also been shown that moderate exercise can actually stimulate appetite, which is very helpful in patients who've been treated with chemotherapy, which in and of itself can reduce appetite. So exercise is very useful, and it's really something that we need to pay more attention to. Cancer rehabilitation can be used in many settings. There are some contraindications, meaning medical issues which we need to be careful of in a medical setting, which is why someone with any type of cancer, brain tumor, or other type of tumor, before they embark on an exercise program, they should consult with their physician, be it with their currently being treated by their oncologist or by a rehabilitation physician or both. You want to make sure before you treat a patient for fatigue, for dyspnea, which is shortness of breath on exertion, dizziness, lightheadedness, and we'll get to some of these symptoms in a little while. We want to make sure that there isn't something else going on that needs to be treated first before someone embarks on an exercise program. Of course, blood work is monitored in cancer patients as well. So there is, again, evidence that exercise helps prevent cancer recurrence in certain types of cancers. Nothing is a silver bullet. We just have to look at each person individually, and once we do, we really can tailor a proper rehabilitation program for them.